They say the greatest problem in communication is the illusion that it has taken places. In the world of healthcare, that illusion can lead to some of the most difficult moments a family would ever face. So in today's episode, we'll talk about effective communication through healthcare planning.
So we have with us today Connie Jorsvik, who was with us last time. She's the founder of Patient Pathways, and thank you so much again, Connie, for coming.
I really appreciate being here.
Yeah, thank you. And again, I know we're going to have a lot of information to share. So first off, I guess the question is, how important are communication skills when something happens and we're finding ourselves having to navigate through our healthcare system?
I would say that when I'm working with people, when I'm doing workshops with people, it's communication is the absolute number one tool. Lack of communication skills can get you into a lot of trouble, and we'll go into that a little bit more.
Yeah.
But having good communication skills, being assertive is really important, and a lot of us have those skills. So if we don't have them, if we recognize that we are not the best communicators in the world, that we're passive, or we know that we've got a hair trigger temper, those kinds of things, being self-aware, have somebody on your team who can be more assertive, or tap us on the leg and it's quiet. You be cool. We can be quiet.
No, exactly. So someone who can be a bit calmer, in maybe what could be a stressful or heightened situation.
And of course, they're always stressful. I don't think that there's anything. Well, maybe going to our lawyer or going to our bank or maybe to or selling our home.
Right.
Are highly stressful situations. But when we're in a healthcare situation, it's probably the worst time in our life.
Absolutely.
And so even for me, this is all I do is communicate when I'm the one who's going to the doctor, when I'm the one who's having, or my children, or my adult children, or I'm the representative for their father, I can feel that it's more stressful in those kinds of situations.
Of course.
And we forget stuff.
Yes. Yes.
So studies show that we only retain as little as 20 to 40% of the information that we are told in a doctor's appointment.
Right.
And I find and then we get half of that wrong. So when my mother was a classic one, Mom, what did the doctor say? Oh, that everything was fine. and it's not that she was trying to be, that she was keeping anything from us.
Right.
Probably she didn't remember what was being said in an appointment.
So in that case then, what should people do? You're sitting in an appointment, the doctor's talking all these medical terms, how are you supposed to remember everything?
If people are watching this online, I'm holding up a notebook.
Okay.
This is your number one tool. So when I was a nurse, I used to have a stethoscope around my neck. My pocket was full of pens and syringes, and I had my emergency manuals, and all of those kinds of things were on hand. As soon as I left that profession, all I had was communication.
Okay.
My notebook does not leave my side. Like it goes absolutely everywhere with me, and so I highly encourage people to have a good notebook. There are AI tools that you can record a conversation in a doctor's office. So if you are technologically savvy and you can download a thing, doctors are using AI right now to record all of their conversations,
Really?
and they're
Oh.
sending them back to patients immediately. So
Should we ask? Are you recording this, or
Yes.
can we ask if we can record?
yes, yes.
Okay.
And so a lot more doctors are being proactive and saying, yes, please go ahead and
Oh,
record this conversation.
okay.
Some of the, I'll use TELUS Health as an example, is that you will get your notes back within probably faster than you were getting home to look on your computer. So there'll be a
Right.
summary of your appointments. Do be aware that your doctor is supposed to announce if they are using an AI tool
Okay.
to record
Yeah.
the conversation.
Yes.
And I would say to go over your notes as quickly as you can because you're going to forget a lot of it. For instance, I had a little tiny tear in my retina, which is very common as we get older. And the nurse came out to put drops in my eyes, and she was trying to put them in my left eye. And I said, but it's my right eye. And she said, this transcript says that it's your left eye. And I went, but the transcript is wrong. I can't see out of my right eye. And so it's really important that we look back at our notes to make sure that they're accurate and let our doctors know right away if they got something wrong.
Right. Even more important if you're going for surgery or something.
Yeah.
You need to know which side is which, right?
Yeah.
So I believe like when we are in the hospital, our family will rely on the notebook you mentioned.
Yes.
So what other information we should have, definitely should have in that notebook?
Well, everything that you're putting in that magic envelope that we talked about last time that's on the
right.
fridge, the in
Right.
case of emergency,
Yeah.
it's a really good idea to either have that in your notebook, or I recommend to people that they have a wallet-sized card that can be
okay.
with them everywhere, that it says, I'm type 2 diabetic, I have well-controlled high blood pressure, I had open heart surgery, 2 years
Right.
ago. Those kinds of things are really important. Like summarize it, make it short. And then on the back, put your medications.
Good idea.
Because how often do we go to a new specialist or a new appointment, our physiotherapist or whatever, and they say arrive 15 minutes ahead of time, and they give you 5 pages to fill out. And we often cannot remember
Yes.
all of those. And as we get older, there are more medications that are added. There are names that are unpronounceable.
Yes.
And so either have a notebook, have it on your phone, or have a wallet-sized card that you can just pull out and go, oh, these are my medications.
And the good thing, like because I'm using an iPhone, I know there's a health record information. I actually put that in, and in case of emergency, then my wife will know what kind of medicine I'm taking,
Yeah.
what kind of blood type, in case she doesn't know.
Right.
I know she knows. Yeah, so that's very important, and everybody should have a cell phone, and I think that's very handy.
I think that most people have a cell phone, and I think that the one piece of the population and our audience are often older
Yeah.
and don't have the technology
Right.
to
Yes.
manage that. So on your phone, whether you've got an Android or an iPhone, there are in case of emergency settings, which are in the power settings. But just do a Google search. How do I put my in case of emergency information
Right.
in my phone? And the paramedics and the hospital team do not need a password to go into that.
Right. Yeah.
The general population is not going to know that they can get into your phone to do that. But it should have your emergency contacts and anything that's really important. So if we've got a Google Drive, if we've got Microsoft Word on our phone, we can pull up all of our documents and share those with the people who are important,
Right.
our representative, our power of attorney, and so that they know where they can go to their phone
Right.
and show it to the emergency room staff and say, here's the representation agreement, it's signed,
Right.
so that they've got that handy.
Yeah.
There's so many ways to communicate
Right.
now.
Yeah.
So a lot of family are afraid of raise the tough question or
Oh, yes.
communication.
Yes.
So in your example, how do we raise that question with our like senior parents? They are refusing, they are reluctant to have that conversation. How can we start, and what kind of approach we should take?
Empathy is the biggest tool. I understand, Mom, that you don't want to talk about this, but you're getting older and I might need to make some very big decisions for you.
Yes.
I know that this is difficult, and it's difficult for me too. So why don't we have a conversation and then we can say it's done.
Yeah.
We don't have to worry about it anymore. Bring up really important things like, would you want your heart restarted if it was to stop? Would you want to have dialysis? Would you want to be fed if you can no longer feed yourself? If you had advanced dementia, when would you want us to stop antibiotics? Ask some very specific questions. Write it down. As I said in the last one, it doesn't have to be a formal document. Just write it down, have them sign their name and the date. It will give you a lot more information at that time.
Right.
When you're talking about yourself and somebody doesn't want to, husbands are famous for not wanting to know about their wives, ever being sick, ever going to the hospital, say, I know it's uncomfortable for you to talk about me being sick.
Yeah.
But I want you to be able to make the best decisions for me. So let's briefly bring this up. When I was talking, I'm really good at talking the talk for somebody else.
Yeah.
But in my world, I knew that I needed to walk my own talk.
Right.
And so my daughter, she could be a little volatile. So I didn't want to bring her down if she was in a good mood. I didn't want to make her angry if she was in a bad mood. And so I got a bottle of wine, I got out the crib board, I put them down, and I said, we're going to have a glass of wine and play a game of crib. But first I want to tell you what I want should anything difficult, if you have to make difficult decisions. It took 5 minutes, and I said, and she goes, is that all? And I said, yeah. And she goes, yeah, okay. But what it did was open up the door for the next time. So I said that I would prefer not to go to long-term care.
Right.
I know that I might need to, but I don't want to. And she went and visited her partner's father, grandfather, who was in long-term care. And she came back and she goes, now I think I know what you're talking about. And so we've had conversations along the way about medical assistance in dying. Just having that first conversation opened the door.
Yeah.
Do you have any like checklist of what kind of questions as a family to raise? Because there's a lot, especially when we at the moment we may not think about, we should ask those questions. Do we have any resource to find out what those questions are and be able to ask those?
I've got a lot of them in the current book, Navigating the BC Healthcare System, and you're going to put that in the resources
Yes.
about advanced care planning, and there are a bunch of questions. In the new book that we're writing, and Karina's going to be a part of that, I'm going to get much more specific about those kinds of questions and in what kinds of situations. And I will let you know, and you can put that out.
Yeah, that's very informational.
Yeah,
very valuable.
Exactly. Well, I just thinking now here, say you are in a situation where you've expressed your wishes, but for example, maybe a healthcare provider, a doctor specialist is not moving on your wishes or denying you, basically what your spouse or loved one wishes. What do you do then? Like, what are the next steps?
Again, in a hospital or in a long-term care facility, a key person is the social worker.
Okay.
They are trained in having these kinds of conversations. The number 2 person in my book is the patient care coordinator, the charge nurse. Okay. If you just say to anybody, who's the charge nurse, those are keywords. And you can go to the charge nurse or the director of care or wherever it is, who's in charge.
Okay.
And say, I'm really concerned that this is not what my father would have wanted.
Right.
And I was in a situation like that where the healthcare system kind of just keeps on going like an engine. And they will introduce antibiotics. They will give all of those, the things that are life-saving because that's their job.
That's right.
And she knew that her father didn't want any of it. And so we actually had to, the healthcare, the team on the unit were not listening to her because she was not the representative.
Oh, okay.
So being a representative is really, really important in these situations, but we accelerated it to the patient care quality office.
That's in the hospital?
That's all the hospitals, all of the, no matter where you are in the healthcare system, whether it be home care, long-term care, there's a patient care quality office, and that is supposed to be posted in a public place all the time. So the main place is by the elevator, or even in the elevator, they will say, do you have concerns about care?
Okay.
Reach out to
Good
us.
to know. All right.
So in case of people from different culture or language, do you have the resource? Because they may have a trouble to raise those questions, to talk about this. Do you have any support in the hospital or healthcare system in order to help them to facilitate that?
That's a really good question, and I actually saw it in practice. A couple of weeks ago, I was with one of my clients in the emergency room, and there was a fellow in the next bed who was speaking some South Asian language, and they have the ability, they actually brought in a little machine, one of those things on a stick, a monitor on a stick.
Yeah.
And that person was interpreting on the spot. They are legal interpreters. So encountered that a lot with medical assistance in dying. And all the clinicians have the ability to have somebody either on their little laptop or on their phone so that they can call up in something like 78 different languages to have somebody available.
Yeah.
So even at the middle of the night, 24/7?
24/7. That person's available.
Okay. That's very good to know.
Well, you talked about at the very beginning about being assertive. So there's a difference between being assertive and being aggressive, which we did not tolerate. But, we hear a lot, the squeaky wheel gets the grease. So if things aren't happening, or say you've got a doctor or a specialist who's dismissing you or things like that, how do you approach it? What steps do you need to take?
Sometimes people will actually need somebody like me to help coach them
Right.
on being a more effective communicator. But most people are, just a few clues. They'll be able to figure out what they need. And, but number one is honey always works better than vinegar. Wherever possible, I will use humor or compassion. So one of the big problems is doctors' offices. They've got receptionists who I call gatekeepers. And if you're lucky enough to get a real person on the phone, but quite often we have to leave a voicemail. So be ready for that. What is the name, your name, or the name of the person you're calling on behalf of? What is their date of birth? What is their personal health number? And why are you calling? So I call that a script.
Right.
If you are feeling underconfident or, English is your second language, write it out ahead of time. Expect that you're going to get a voicemail and say, hi, my name is Mary Smith. I'm phoning on behalf of my husband, Bob Smith. His personal health number is, we were referred by Dr. Jones on such and such a day. I'm just phoning to make sure that you received the referral and when I might not hear back. My phone number is blah, blah, blah. If I don't hear from you, I'm assuming you got the referral.
Okay.
Really important things that you follow up on referrals because quite often in British Columbia, we rely on fax machines. But there's a reason for that. Information is not supposed to leave the province electronically. So if we're using Gmail, it's not only leaving the province, it's leaving the country.
Right.
And so we use fax machines. fax machines are faulty. There might not be paper at the other end.
Yeah.
There might, it might fall on the back of the desk. It might end up in somebody else's file. There's a lot of reasons why faxes are prone to difficulty. And so I always just phone about a week later to make sure that information has been received. Even if it says, if we have received your referral, we will be contacting your doctor's office. If they say that, then contact your doctor's office.
Right.
People have died because their information has not been received at the other end.
So follow up.
Follow
Okay.
up. And when
Right.
you're in the hospital, go and ask to have a team meeting. Go and see, especially if discharge is coming up and you know that it's going to be difficult.
Right.
I mentioned to you in a phone call not too long ago that discharge planning is not automatic anymore and that we have to plan ahead.
Yes.
So, we've got 25 stairs up to the front door and we've got multiple levels in our house, and I'm really concerned about this. Who can we talk to? Either it can be the occupational therapist, the physiotherapist. But if you're really concerned, how can we have a discharge planning meeting to get this person to the right place?
Okay.
So who should we bring into our discharge, have that conversation for discharge planning?
First of all, it's just too much for this information session, but in the book and on my website, Patient Pathways, under Navigating the Healthcare System, I've got who is who in the healthcare zoo.
Right.
And it lays out who is responsible for what things.
Great.
The bigger the hospital, the more you need to know who is in charge. So Vancouver General, Richmond Hospital, St. Paul's, they usually have somebody for every unit who is in charge of discharge planning. And so just phone and say, can I speak to whoever's in charge of discharge planning? Be proactive. Discharges are the number one place where no news is not good news.
Okay.
When I was a charge nurse, I would be getting phone calls from all the various departments first thing in the morning, and they would say, who can you discharge? So even if we had not talked about it on a Thursday evening, the family was not aware on a Friday morning that discharge may happen. Certainly on Mondays. Mondays and Fridays, bad days. Expect to go home before you're ready. What equipment do you need? How do you get it? Who do I talk to about that equipment?
So it sounds like you may not necessarily get all the answers to those questions on the day of discharge. So you might have to be scrambling.
Yes.
I didn't realize as well, like you can call for a team meeting.
Yes.
You're allowed to do that.
And sometimes it's just not possible.
Right, okay.
It's just not possible to bring in all the people that you need to, but the number, there's the social worker, the occupational therapist, the charge nurse are key people in finding the resources that you need.
So just in case like when we're in hospital, we have a challenge to communicate with certain doctors, any things we can advocate for ourselves or any steps we can take?
If you're by yourself in the hospital, you're already sick, you just want to just curl up into a little ball and get better. But we need to be even more assertive. And I'll go in and visit people and I'll say to them, so what happened today? Oh, nothing. Did you go downstairs for a CAT scan or an x-ray? Oh, yeah. Did somebody come and take blood? Oh, yeah. Did somebody... did you get any new medications?
Right.
Well, yeah. They're thinking that nothing happened, but a lot happened. So it's really important that 20 to 40% of the information that we normally can take in is even less when we're sick.
Right.
Bring a notebook. Write down who is your nurse for the day. You'd think that would be common, but nurses are not identifying themselves anymore, and it just boggles my mind. Who is my doctor? Who's going to be in charge? If a resident comes in to talk to you, because in the big hospitals, most of the time, it is run by residents rather than your surgeon or your specialist.
Right.
When your resident comes in and saying, you're going to go for surgery tomorrow, I'm here to go over the consent with you, write down what you're consenting to and who was that doctor who came and talked to you.
Right.
You may not ever see that doctor again. So it's important that you're writing things down. And I say that, write down who all your nurses were because you won't remember. And then if everything good happened and it was a completely easy admission to hospital, at least you can send chocolates and thank you cards.
Okay.
Yeah, that would be nice.
Because you've got their
That's a
names.
very good
Yeah.
idea. That's very good. So basically, good communication is very crucial for
Yeah.
in this matter of life and death, and
Yeah.
for right people to talk to
Yeah.
and take good journal.
Yes.
When even you are sick, I think that's a very crucial part.
One
for
other
us.
really important piece is also communication, but it's who we are. So people should be saying, and we get tired of saying who our name is and what our
Right.
birth date is,
Right.
but it's really key and important information. And so the biggest errors in a hospital are medication. So if you're a patient and a nurse is coming in, they've got ID bands now that actually are scannable. Make sure that your band is being scanned. If you don't recognize a medication, say, what is this medication? And the nurse might say, well, Dr. Smith ordered it this morning. What for? Like, you have the right to ask
Yes.
those questions.
Yes.
Because nurses are in a hurry. And what if she is saying, 20 bed 2 when that medication was meant for 20 bed 1? So be assertive about saying, and you can do it quietly. Just hold out your armband so that they know
Yeah.
that this is a clue
Right.
to look for to scan your band.
Right. Wow. Okay.
It's hard work being a patient.
It is hard work.
Yeah.
But being your own advocate as well, right? And knowing you have the right to ask these questions about medication and what the different things are for.
Yeah, especially when we are from England coming to Canada,
Yes.
a new different hospitals with different languages that people really have hard time to advocate, and they
Right.
don't really know, and they probably will feel nervous when they ask those questions for sure. So I think it's very crucial to have a certain person like you to
Yeah.
be able to advocate and understand the situations and then
Yeah.
just.
And the biggest people that we need to look after are our elders.
Yes.
And numerous studies have shown that people who are elderly, who go into hospital by themselves, have much poorer outcomes than people who have somebody with them. And all that person needs to be doing is asking for water, asking for a warm blanket. Because when a nurse comes
Right.
in and she's brought you the warm blanket and she sees now that mom is not doing as well, maybe mom is not as responsive as she was last time, it is a clue. So you don't have to be asking all sorts of big questions or those kinds of things. Just quietly advocating for your loved one,
Yeah.
saying, I'm concerned about mom.
Right.
She's not as bright as she was yesterday. Or my mom has dementia, but she's not usually this confused. Just bringing up things that are of concern is massive, because when you are the patient and you're getting sicker, you're not going to be telling people that you're getting sicker.
No.
You don't know. You're just withdrawing into yourself, and you need somebody to be there for you. Even if it's a neighbor or a friend or your pastor from your church who, church visitors, those kinds of things. Go, this Mary is not the same person she was 2 Sundays ago. I'm really concerned about this. Can make a big difference.
So I think, Connie, maybe the last questions. Let's say if the one action we can start today, what's the actions you will recommend our friends to be able to take?
Number one, always, even if you think that you've talked to your loved ones about what you want and what your preferences for future care are, bring it up again. Be assertive, and be empathetic. I know that you don't want, this might be uncomfortable for you, but it's really important that you listen to me, and then we can let it go. Mm-hmm. The other one is have a way to communicate, whether that's on your notebook, whether it's an app in your phone, whatever it is, record your conversations, and do that as quickly as possible.
Yes.
People, our memories play tricks on us. And so it's really important to go back to our notes and review them and see what the doctor said. So communication.
And I also really like your suggestion of having a card, with the summary of your medications and your, all your information there, which is great.
Yeah.
Yeah.
Thank you.
Well, Connie, thank you so much for joining us today and give us a really wonderful advice about communication and keep good record to be able to advocate ourselves. And I think that's very crucial, especially when we are feeling down or our family of loved one who really need us to voice that. Thank you so much.
Thank you.
Thank you for joining us, Connie.
Thank you. Such a pleasure being with you.
A huge thank you to our guest, Connie Jorsvik, founder of Patient Pathways, for joining us today to share her expertise as a senior healthcare navigator and patient advocate. Here are your design insights. Use empathy when it comes to the hard talks. Tell your loved ones that knowing each other's wishes reduces the burden for everyone during a crisis. Start small to open the door for future conversations. In the healthcare system, honey works better than vinegar. Remain calm and positive, but stay assertive. If you feel overwhelmed, bring an advocate, a friend or a family member who can speak for you when you cannot. If language is a barrier, request for an interpreter. Provincial health services provide interpretation for over 200 languages. You can find more info at phsa.ca. Always identify yourself when interacting with the healthcare team to reduce mistakes. For following up on lab results or appointments, we have prepared tips and scripts in the video description to help you get started. Make the notebook your best friend and document every appointment. Whether you write it down or record audio with consent, of course, having a record prevents critical details from slipping through the cracks. If artificial intelligence is used to transcribe a recording, always double-check it as soon as you can for accuracy. Finally, keep your in case of emergency information within reach, either with a wallet card or by setting up the emergency medical information in your smartphone. Know your rights. If you aren't being heard, you have the right to speak with a social worker or a charge nurse. For formal resolutions, contact the Patient Care Quality Office. You can usually find their contact information online or post it in a high-traffic area such as the information desk, the elevator, or waiting areas. If you have any questions or topic suggestions, reach out in the comments or email us at gracefulagingbydesign@gmail.com. If you found this valuable, please like, subscribe, and share. It'll help us grow and reach more families who need these resources. Thank you very much for watching. We'll see you in the next episode.